So, Stephanie, you've been diagnosed with hypothyroidism, which is a form of underactive thyroid function. Talk a little bit about your diagnosis and how you found out that you were hypothyroid.
Yeah, a few years after my first son was born, we were trying to have another baby and just having trouble getting pregnant, staying pregnant. My midwife checked my TSH, my T3 and T4 levels, which are all related to thyroid health, all those hormones. My TSH was just slightly high at 4.6, so she prescribed a small dose of Synthroid that I still take. And we have a second child now. I think that did help me probably normalize things and have a second baby, and I just still take it, and I think I'll probably have to take it for the rest of my life.
It's interesting that you got diagnosed during your pregnancy because we can sometimes see that. So, pregnancy can trigger an autoimmune form of thyroid dysfunction called Hashimoto's thyroiditis, which is inflammation of the thyroid gland that causes dysregulation and less secretion of the thyroid hormone and can cause downstream effects. So let's talk a little bit about the thyroid gland. It's basically a butterfly-shaped gland right here at the base of our neck, and it is involved in making thyroid hormone, which regulates many different functions in our body, including our metabolism, our weight, our temperature, our heartbeat, many different types of functions. And the way that it's regulated is from the brain. So the brain has a gland called the pituitary gland, which releases a hormone called TSH, thyroid stimulating hormone. So that's kind of like the regulator of the thyroid gland. So the brain releases the TSH, which then tells the thyroid gland to make T3 and T4, which are the active thyroid hormones. So if you don't have enough T3 or T4 around, there's a signal that goes to the brain and says, brain, make more TSH because we need more T3 and T4 around. So TSH tells us really about whether or not you have enough thyroid hormone around. And the normal range is about 0.45 to 4.5. And it can vary from lab to lab, but that's usually around the normal range. And if you're above that range, you're hypothyroid, meaning you don't have enough thyroid hormone. And if you're below that range, you're hyperthyroid, meaning you have too much. Now, I'm curious, Stephanie, because when you do have hypothyroidism, you can develop some symptoms. Did you have any symptoms when you were diagnosed?
Yeah, I was told some symptoms are being extra tired or maybe hanging on to some extra weight. As a mom, I always feel extra tired. I always kind of felt like there's some extra weight I could lose. So I didn't think really anything of those. Looking back, I guess I, probably was feeling more tired even than I am now with a new baby, but nothing that I really noticed or it was a red flag. And you said to 4.5, my level was 4.6. So really I was barely high, and my midwife just thought we should try a low dose of Synthroid to see if it would help me out.
Oh, and what's very interesting about what you just said is that these symptoms can sometimes be very subtle. So let's talk about the symptoms. If you have too little thyroid hormone around, think about everything in your body slowing down. So you gain weight, you can get depressed, you can feel tired, you have dry skin, you can have hair loss, changes in temperature regulation, like you feel cold all the time. You can have constipation. Really, all the functions of the body are slowing down. And then the opposite is also true. If you're hyperthyroid, all the functions speed up. So it is important to make sure that you check your TSH if you think you may have some of these symptoms.
I did receive a follow-up screening through 9 Health, and my TSH is around 1.6 now, so it is in that good range.
Yeah, so it's really important not just to check it once, but to continue to check it after you get on that medication to make sure you're on the right dose and the frequency of the medication.